releasing the dream of molecular target therapies for cystic fibrosis. Definition: cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time.
A patient with cystic fibrosis is susceptible to infections of the lungs. This is due to a mutation that affects a protein on the surface of lung cells. Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis. With less water, the mucus becomes thicker and cilia can't move. Flow is reduced, providing an environment for bacterial infection. But there are now drugs that can help patients. To find a drug, researchers tested over 200,000 small molecules to see if any would bind to the CFTR protein. Then, for each small molecule that had some binding ability, researchers chemically synthesized different variations of that molecule and tested them for the ability to improve the function of some types of mutant CFTR channels. They identified a drug that, when taken by patients with a certain type of CFTR mutation, binds to the CFTR protein, opening the channel and allowing improved ion transfer. This increases chloride ion flow and maintains a watery, clear mucus, which helps the cilia move more freely and reduces the risk of bacterial infection.
Hi, my name is Deborah Boyer, and I'm one of the pediatric pulmonary doctors here at the Children's Hospital Boston. Today I'm here to talk to you about cystic fibrosis. Cystic fibrosis is a genetic disease that causes the cells in your child's body to have difficulty handling the movement of sodium and chloride. This ultimately ends in the production of some thick, sticky mucus, and it's this thick, sticky mucus that leads to the side effects that we see when children come to our clinic. So the organ most commonly affected in cystic fibrosis would be the lungs. And if you take a closer look at the lungs here, a cross-sectional area, you're going to see what are called the bronchi, or the airways of the lung. And if you take a look at one of these normal airways depicted here, what you're going to see would be a muscular layer and then a big tube where the air passes through. This tube has a thin layer of mucus in a patient who does not have cystic fibrosis. When you look at the airway of a patient with CF, as depicted here, you're going to see some infection or bacterial growth in that airway, and that bacterial growth is going to lead to this thick section of mucus that obviously is going to make it a lot harder for air to flow easily through that airway. Another major concern that we have in children with cystic fibrosis would be their growth. And the reason for this is that about 90% of patients with cystic fibrosis have what we call pancreatic insufficiency. What this means is that the pancreas, located here, is unable to secrete the proper enzymes into the small intestines, right here. This then means that your small intestines can't absorb the right nutrients to allow your child to grow properly. There are other organs affected by cystic fibrosis, and these could include sinus disease. And again, this is going to vary in child to child. Other children may have trouble with their liver and have evidence of liver disease. But the one thing I like to emphasize to parents is that the organ that's not affected by cystic fibrosis would be the brain, and your child's going to grow and develop and think just as they would even if they didn't have cystic fibrosis. A common misconception in cystic fibrosis is that patients have an extremely limited lifespan, and that's not exactly true. The average predicted lifespan in a patient with cystic fibrosis is 38 years of age. If you think about it, though, those are patients that were born 38 years ago when we had a very limited treatment option available to us. Children born today with cystic fibrosis have a whole variety of treatments that I can offer them that weren't available 38 years ago. Many of these treatment options are the result of a lot of research, many of which we are actively pursuing here at Children's Hospital Boston. Because cystic fibrosis is a lifelong disease, it's critical that you develop a strong relationship with the clinician and the team that's going to help take care of your child. Here at Children's Hospital Boston, we do this every day, and we're very comfortable taking care of your child from the school age years through the difficult adolescent years, and then as they transition into an adult cystic fibrosis program. So you can be assured that we'll be there for you every step of the way along that process.
Applications in medicine. It's important to know about the diagnostic of cystic fibrosis that is a multi-step process and should include a newborn screening, a sweet test, a genetic or carrier test, and a clinical evaluation.
It can affect a baby's lungs, digestive system, and pancreatic system. Doctors say cystic fibrosis is an autosomal recessive disorder that many parents have no idea they carry.
We recommend by the American College of OB/GYN guidelines, or ACOG, that all pregnant patients or patients that are considering becoming pregnant be screened to see if they are a carrier.
If the mother tests negative, there's no need to test the father. Cystic fibrosis happens when a baby inherits a mutated gene from both parents. If both parents test positive, there's a 1 in 4 chance that the baby will be born with cystic fibrosis.
To this point, there have been at least 1,700 different mutations that have been identified that can cause cystic fibrosis. Most adequate or accepted screening tests screen for 23 of the most common.
The screening is a blood test that became available in 2001.
Even if the screening were positive, it would not affect the type of the prenatal care received.
If only one parent is a carrier, the child will likely become a carrier too.
It wouldn't exhibit any signs physically or clinically. It would only be detected through genomic screening.
Unlike other prenatal screenings, cystic fibrosis screening only needs to be done once. Because the test is based on the genetics of the mother and father, the outcome of the test will not change with each pregnancy.
The median age of death from this disease is around 42 years old, and usually from respiratory failure.
Treatments have improved for patients diagnosed with cystic fibrosis, but the quality of life can be difficult. Doctors encourage patients to be tested before they become pregnant or when they become pregnant, so they may be educated on the type of care their child may need. For Lee Health, I'm Lindsay Morton.
Pros and cons. Pros. Most people are diagnosed with CF by the age of 2 years. The correct diagnosis better the patient's lifestyle. Cons. There is no treatment for the cystic fibrosis, but there are some options that reduce the symptoms and better the patient's lifestyle.
My name is Emily Apakian, and this is Cystic Fibrosis My Way. I'm 17 years old and I'm a senior in high school. I live with CF and I'm treated at CHOP. When I grow up, I think I want to become a doctor and cure CF. But my dream job is to get my scuba certification and become an underwater photographer. I have such a busy schedule that I don't always have time to do my vest therapy, so I do my a cappella treatments instead. It helps get mucus out of my lungs and it's portable too. So this is how I do my a cappella treatment. I place my mouth around the mouthpiece, making sure that it has a tight seal. Next, I breathe in slowly and hold my breath for 2 to 3 seconds. It's important that you blow all the way out while keeping your cheeks tight so that you can feel the vibrations in your chest. I do this about 10 times, and at the end, I do a huff cough. And then I'm done. Now I feel better and can get in shape to learn how to deep sea dive. I have so many big dreams that nothing, not even CF, is going to get in my way.
Issue apply in Ecuador. In Ecuador, it is important to know about the options for better the patient's lifestyle and how to diagnose this disease. Conclusion. Cystic fibrosis is a genetic disease that doesn't have treatment, but there are many options that better the patient's lifestyle and reduce symptoms.
When you see me, what do you see? A kid? A student?
A teenager? A tomboy?
A musician? An athlete? An artist? I look like everyone else, but I have cystic fibrosis.
Or CF?
I have CF.
I have CF.
I have CF. And you wouldn't know unless you know.
Because I don't look sick.
I should be treated like any other kid. But here's the thing.
I may need to go to the restroom more often.
Eat in class more often than an average student. And cough more often. A lot.
But I am not contagious.
I promise.
I might be absent from school
For doctor's appointments, lung infections,
or even hospital stays.
right now there is no cure for CF.
And it will not go away.
CF doesn't affect my intelligence. And I really want to learn.
But I might need your help with keeping up with my schoolwork. With your help and understanding,
I can have a normal school experience just like everyone else.
and that would be cool. Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you. Thank you.